Hello and welcome to PulseCheck with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? All right, welcome in everyone. I'm Morgan, and on today's episode of PulseCheck, we are so lucky to have Tiffany here with us to talk all about our first year as a new grad nurse, what it looks like, what we wish we knew, and maybe some tips to make it a little easier. Plot twist, your first year of a nurse is never easy. It's definitely a challenging year, but we are here to give you some of our insights from the other side and hopefully help you through it. So first and foremost, welcome to the show, Tiffany. We're so glad to have you here.
Thank you. Yeah, I'm super excited to be here.
Amazing. Well, tell the audience a little bit about yourself, where you come from, and your nursing background.
Okay, so I've been a nurse now 17 years. Had to think about that today. So I started back in 2009 when things were a lot different. Social media was barely a thing. So I started in med surg, worked night shift. So shout out to anyone who works night shift. But then I did 2 years and I got travel nurse experience for the next 10 years of my career all over the country. Hawaii was my favorite place to be. But I worked anywhere from step down, ICU, ER, procedures, more med surge, and then ended up in float pool. And then I found my love for education about 6 years ago. And now I am the manager of pre-licensure and CE services here at Archer. So new grads have a little special place in my heart because I feel like I just always interacted with them as a travel nurse. People always looked up to me, which made me feel like I loved teaching. So I just love new nurses.
Oh my gosh. Well, total side note, we'll have to talk about Hawaii later because I also travel nursed in Hawaii and ended up staying on Oahu for a year because it was the best thing ever. So
I was in
we'll
Maui.
have a lot to talk about after the episode.
Yes.
We won't bore you guys with that. I know what you're here for is tips about your first year. So let's just dive right in. Tiffany, you obviously have a wealth of experience. If you have a new grad coming to you or, graduation's coming up, so we're about to have a lot of new grads joining the workforce, what's one piece of advice you would start with just as a level set for everybody?
I think this comes in two parts. I know you said one thing, but two parts.
Well,
So
thanks.
first, it's okay not to know everything, and it's okay to be a little slow at first. So I think new nurses have a fear of having to get things done so fast, but you don't know everything. So it's okay to take your time, understand policy and procedure, understand what you learned in a textbook might be a little different than how you do on the floor. So really, it's okay if you don't know anything or everything,
Yeah,
and it's okay to take your time because you want to do things right. And
that's
I feel like if someone told me that when I first became a nurse, I wouldn't have been like running around so fast all the time.
right, right. That resonates so much with me, especially the you don't have to know everything. I think when I graduated, I had that fear or that like expectation maybe is a better word where I really thought like, okay, I've passed my NCLEX. That means that I've checked the box, like I know the things. And I was definitely pretty afraid to ask questions and reveal that like, oh, I actually don't know what this medication is for because it was probably in my textbook, but I don't remember it. And I forget exactly when it was, but it was pretty decently into that first year that I had this moment where I was like, oh my gosh, some of these nurses don't know either. Like they were very willing to admit, like, oh shoot, I haven't done this procedure in a while. Like, let me go ask Kathy down the hall or whatever. And I was like, whoa, like I admired them for that. So giving myself the grace to be like, hold up, I don't know this. I haven't done this before. I don't remember this from school or whatnot. I think actually makes you a lot stronger than just trying to like fake it till you make it. This is not the place to fake it till you make it.
Absolutely. And that brings me to another point is use your resources. So you mentioned, going to someone else down the hall. There's always going to be someone on the floor who knows a little bit more than you do. So find that person, and that a person is going to be your go-to. It doesn't necessarily have to be your preceptor either. Maybe you notice someone else on the floor that you like their style or you like how they do things, befriend them. And that's exactly what I did as a new nurse. And, it just made me a better nurse because you take little pieces from everyone.
100%. That was I also did float pool, and it was a big reason that I liked float pool because I was like, "Oh my gosh, every unit, every floor, every nurse like has a little bit of a different perspective, a different lens." It wasn't that like this way was right or this way was wrong. But you could kind of take the best from all worlds and like find what worked for you. But it definitely did require, like, finding those experiences and those nurses that weren't always your preceptor. I had some great preceptors, and I had some I don't know if you can relate, I had some not so great preceptors that, maybe just for me, it wasn't like we didn't click or whatever, but I don't think I would have gotten a lot out of those experiences if I hadn't kind of sought those other learning opportunities and found those people around me that I could feel really comfortable being like, I don't know anything about XYZ, or, can I watch you place that pick line? I've never seen that procedure before or whatever.
Yeah, my preceptor made me cry, which is also
Well,
okay, you know? Um, she was great. I had her for my full whatever, I think 12 weeks back then. I'm not even sure exactly what it was, but she was tough. She was a tough cookie. So my first job was in Connecticut at Yale and New England, we tend to be a little bit more tough. And she was, but I'll never forget what she taught me, and I'll never forget the tears I shed, but they were worth it. They really were. She made me a better nurse. Absolutely.
that's like the epitome of what we always say here at Archer, that it's hard, but it is worth it. Like I said at the very beginning, this is going to be a really hard year. I don't want to like sugarcoat that. And it's not like then magically after a year, you're like, oh, I'm not a new grad. I'm perfect. I've got it all. Like, we all are going to continue to learn for our entire career. Not just with, I always say, like, I could go take the NCLEX today and see something new. Every shift at the hospital, I am now an outpatient and urgent care. And every single day there is something new. So like looking at that as a learning opportunity and not as like oh, I'm not good enough because I don't know it. I think reframing that is absolutely essential, really in that first year, because there's going to be a lot you don't know. But I mean, honestly, for forever, right? We're going to be learning for forever.
I think working during COVID taught me a lot about that, especially because we all didn't know. We were all learning day by day, second by second, and something like that could happen again, and you just roll with it and remember safety, remember patience, and that's what we're all here for, and
Right.
kind of take it from there.
Yeah, absolutely. And recognizing that not everyone's going to do it exactly the same. I think going back again to working in the float pool, and I know you said you did the float pool as well, you get experience to all sorts of different styles or techniques or bedside manner. And like, I think another thing I thought graduating and going into being a new nurse was like, there was a right way and there was a wrong way. And don't get me wrong, there definitely are wrong ways. Like, there are wrong ways to go about things, and we need to learn from that. You'll probably do some of them, and you'll learn from your mistakes. That's
Yeah.
cool too.
Yeah.
Um, but there is very rarely, in my personal opinion, one right way. Oftentimes, there are more than one right way. So, knowing that, like, giving yourself the grace to like try different things based on those learning experiences, I think that's another one that I maybe didn't totally expect when I graduated, and in hindsight, I can appreciate.
Agree, and I think a lot of even students now, they're like, "That's not what my clinical instructor told me," or "That's not what
Yeah,
so and so taught me." And I think switching that mentality to like, "Okay, as long as it gets done and my patient's okay," back to
right.
that, it's okay if we do it a slightly different here. And I learned that with travel nursing. I'm not sure if you did too, but every
Totally.
this country they do things a little differently,
Yep.
and that's okay. I learned so much about myself and about myself as a nurse along the way, and I think that is true for new grads too. You're gonna learn so much in that first year. Yes, it's survival mode. Yes, it's you're just trying to make it, and
Yeah.
tears will be shed, and that's okay.
Right.
But you're gonna learn, more today than you did yesterday. I think that's super important.
Yeah, I hear you. The like most random specific example just came in my head. As soon as you said I learned that travel nursing, I had a flashback to my first contract, which was out on the West Coast, and I had been working on the East Coast, and there was a lot that was different. But I had worked at the same facility for like 6 going on 7 years, and I like knew our protocols really well. I knew like if X happens, we're gonna do Y. I'm gonna titrate this drip, based on these parameters. And in my head, I was like, that's just the best practice. That's the way it's done. And specifically with anticoagulation, I don't know why this is all flooding back to me right now, but like I knew how to manage a heparin drip. Like that was our anticoagulant of choice. We were using that. And then at this other hospital, they didn't use heparin. They used bivalrudin. And I was like, I've never heard bival. What's a
Yeah,
bival drip? I was like, I have never heard of this. And I really let myself feel stupid. I
for
was
sure.
like, you've been a nurse for 7 years. You're traveling. You're in the ICU at this fancy hospital and you don't know what this med is. But it was a great example of just like, there are different practices, and you are always going to be getting something that you're not an expert at. So it's okay not to know it. It's okay to ask the questions. Like, you have a lot of resources at the tip of your fingers. Whether it's like, going through the chart or going through your whatever EMR that your hospital provides that has resources and whatnot, finding those different nurses, whether it's your preceptor or not. So, you got to use those resources, even if you're not a new grad. That all just like really, really came back to me in full force.
And now you're reminding me of when I went from East Coast to West Coast and their potassium protocol was so different.
Oh.
And that's something that I was like, wait, this is what works. I don't know why you changed it, but it's just what you said. Every place is going to be a little bit different,
Yeah,
but the patient outcomes are the same.
right.
And the goals are the same. The medication might be different, like furosemide versus Bumex is another example. Like they
Or
do the same things, right? You learn that in school. Why are there all these meds? Well, different places use them for different reasons.
a
There's
reason.
different research out there from different hospitals, or different institutions. So that's such a great point.
They're absolutely right. And that goes back to our point of like, there is usually more than one right answer. There are some wrong answers. There are some things we're going to totally not do. But more often than not, there's not just one way to do it.
Yes.
So, very, very interesting. I love it. And travel nursing is a great way to teach you that if you guys are ever interested in going down that pathway.
But get your experience first
Get your
as a new grad. That is one of the points I wanted to bring up today is because so many new grads say, I want to be a travel nurse like you. What should I do? And my answer is always 2 years experience. I know a lot of places will accept you after one, but one is survival mode, guys. Your first year out there, you're trying to figure it out.
Yes.
You're getting experience. I would get at least a little bit more until you're confident, because you're going to make mistakes. And again, that's okay. But you
Yeah.
gotta learn from them and you gotta learn how to be the best nurse ever because you might not have orientation when you go to be a travel nurse.
Yes, yes. If you do have orientation, the most I ever had was like 3 shifts. That was very generous.
See?
So, and you're expected to be not just safe, but performing at a competent level, which in my opinion, even a year is a stretch. 2 years is really needed for that. I'm in agreement with you, Tiffany.
Yes.
I want to shift gears and ask you about one thing you've said a couple times now that first year is survival mode. So tell me a little bit about that. Tell me what you did to get through that survival mode and maybe some like practical tips we can take away for helping with that first year.
I think you need a support system. That's probably number one. Outside of whoever you work with, I found it really helpful to have non-nursing friends or family members that I could just chat with about not nursing stuff.
Yeah.
That really helped me. For me, it was night shift that I was very new to, and I needed to figure out a routine that worked for me. So exercising on my days off or when I could, eating right, kind of those basics, drinking water, taking your breaks, because sometimes we're just so go, go, go that we just really forget to take care of ourselves. And that's going to burn you out way too soon.
Yeah. Yeah. It's absolutely true. It's my mind flashed to like this is so nerdy of me, but like the basic pyramid of needs, Maslow's hierarchy of needs, right? Like if you don't literally feed and water yourself and take some time for rest, you will burn out. As simple as it sounds, it is actually much harder to do it than it is to say it, and at some point you're going to be forced to prioritize it.
And one more thing is if you make a mistake, it's okay. I
Uh,
think a lot of new nurses fear it that they're going to make a mistake, that they're going to lose their license, or that something's going to happen. But a little story that happened to me when I was a new grad. So with giving blood, you have to administer it within 4 hours.
right.
I worked way long time ago as a new nurse, right? 2009. This particular hospital did not have, we didn't put our blood on a pump, so I had to count the drips.
Yeah.
And so, yeah, I guess my math wasn't mathing, and I ended up in the 4 hours, they had about 20 mLs left. So they didn't receive the entire, unit of blood that they needed. My preceptor gave it to me and said I needed to get organized. I was so forgetful. How could you not pay attention to that? Well, I had 6 patients on a night shift and I was new. And so I had a hard time. But to her point, yeah, that was a mistake. And have I ever done that again? Absolutely not. But I had to write up a whole report about it. I cried about it for days. And I just realized the importance of blood transfusions and why they should get the whole unit. And, it
Yeah.
took someone to have to donate that.
Yeah.
So, there was a lot of things with it. But I'll never forget that. So now this is a teaching point that I bring to students all the time. And there's reasons why we test on it. We have to transfuse in this
Yep.
much time. So it's okay to make the mistake. Did I lose my license? No, but it was a learning opportunity.
I love that you brought that up because I think it's honestly unrealistic for us to think that we will never make a mistake. I had at least 5 things flash through my head while you were talking about forgetting to pre-medicate somebody in time, and then the blood got there and I hadn't given their ibuprofen and Benadryl, and I was
Right.
supposed to have already done that, and so I delayed how quickly I could have started that transfusion. The family was furious with me over that one. And I think I did cry for like 3 days. I felt so bad. So let's just normalize the fact that you will make some mistakes. And just like Tiffany said, you will learn from them. Have I ever forgotten to pre-medicate somebody for their blood transfusion in a timely manner again? No. These things like stick with you to your core
Oh,
in
yeah.
a very special way. So I think just like we talked about, like reframing things as learning opportunities, this is another example of that. Like you are going to make some mistakes, learn from the mistake, and then you'll keep getting that 1% better every day, and that's what really matters in the long run, right.
Absolutely. Yeah, I mean, that was just one example. I'm sure I made way more my first year.
I'll make so many.
That one just sticks out.
Yeah, yeah. It's funny how that happens too, because there absolutely are like certain visceral memories that really stick out. Another one for me is I like for some reason put a Foley catheter in and forgot to document that line. So then the next nurse came behind me and I was, I gave a report. I said they had a Foley or whatnot, but then the LDA wasn't in the chart. And I had an email waiting for me the next morning about how careless I was that I didn't document this LDA. And I was like, oh, how could I do that? And in hindsight, I'm kind of like, okay, no harm came to that client. They are totally fine. Everyone is safe. And I think that goes back to your point earlier, Tiffany. Like at the end of the day, safety is what's most important. Um, your client got that blood over 4 hours. He missed 20 mLs, but you still stuck to that 4 hours and kept him safe. Like the NCLEX is a safety test. Nursing is about safety. So if we fall back on that, we take our mistakes as learning opportunities. I mean that's all we can do, right?
That's it. And not even if you're a new nurse, things are going to happen as you continue.
What's
Like you
happened?
said, as a travel nurse, after many years of experience, you didn't know something, and that's okay. It's okay to learn year one, year two, or year 20. It does not matter.
Yes, we will all be learning. I love it. I love it. Well, I know we're coming up on time here. Tiffany, let's leave everybody with maybe your top, like, I don't know, give us 3 takeaways of if you've only got a few seconds to talk to a new grad and give them some advice about their first year. What are those top tips you want to leave us with today?
So we've talked a lot about mistakes. So I'm going to start with that as number one because they're lessons, not failures. So think of them as learning opportunities. That's my first tip. Second one is probably your confidence will grow as you continue on. So take it one shift at a time, one day at a time, one med at a time. And then number 3 is you made it as a nurse.
Yeah.
So you got this. Just really continue believing in yourself, and I think that that is probably my best advice.
Absolutely. You can do this. It is hard, but it is worth it. Thank you so much for popping on to share all of that with us today, Tiffany. Thank you for tuning in to Pulse Check with Archer Nursing. Again, I'm Morgan, and we will see you back here next time. All right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.link. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.